Hello, I'm Dr. Kester Ifui. In this video, I bring to you a rare case of chorioamniotic separation at the uterine cervix. The patient is a 32-year-old gravida 2 para 1 at 30 weeks gestation. She presented with 2 days of vaginal bleeding. She had had a previous ultrasound which reported oligohydramnios, but there was no abdominal pain or trauma, no history of fetal anomaly on previous scans. The patient was clinically stable but anxious. On transabdominal ultrasound, we found a single viable fetus in longitudinal lie, breech presentation with an anteriorly sighted placenta. The placenta showed no evidence of abruptio, no placenta previa, no vasa previa. The amniotic fluid volume, as previously reported, was confirmed to be very low, anhydramnios, as there was no demonstrable pocket of amniotic fluid that was measurable that was devoid of fetal parts or cord. The key finding, however, was a focal crescentic bilayering of the fetal membrane that was visualized superior to the internal os. So the resulting space between the bilayers contained dense low-level internal echoes, probably extraamniotic hematoma. Now this is consistent with the moon sign of chorioamniotic separation. The internal cervical os measured about 0.58 cm. The residual cervical canal measured about 3.9 cm in length. Now, further on the chorioamniotic separation, the moon sign, on the diagrammatic image on the left side of the screen, we here see depicted fetus in utero cephalic presentation, but we note that between the fetal head and the cervix, there is a separation of the amniotic membrane. If this is the membrane covering, we can see that there is a separation showing us this white crescentic area labeled the moon sign, and that is the space between the separated amniotic membrane layers. The images on the right side of the screen show sonograms. The first sonogram superiorly here depicts a transvaginal evaluation of the cervix of a pregnant woman, showing the moon sign. We see the arrows in this region. We see the arrows here showing some level of funneling, and then there is the chorionic layer of the membrane of the separated membrane here, and then the amniotic layer lines the superior aspect. Now, the difference between them is what we see to be the moon sign, the crescentic shaped moon sign. However, the sonogram below depicts a cervix that shows funneling, right? There is some degree of funneling, U-shaped funnel. However, there is no evidence of separation of the chorioamniotic membrane in this sonogram below. This is just to draw a distinction for us to see what actually happens, the difference between the two situations. And the chorioamniotic membrane separation in the second and third trimester usually heralds premature rupture of membrane, heralds oligohydramnios, it heralds um, bleeding per vagina. Here again, this is the image from our index patient. This sonogram shows us the bladder anteriorly. It's a transabdominal sonogram showing us the bladder anteriorly. We have here the mildly dilated cervical canal and then the chorionic layer of the amniotic membrane and then the amniotic layer. Now, the space between them is showing is crescentic, and that is where we refer to as the moon sign, and it contains dense internal echoes which represent extra amniotic hematoma. Here is another image from a transvaginal scan on a patient showing us the linear echogenic structure. Here of course represents the cervical canal. The cervical canal. Here's the cervical os, and here again we see the crescentic shaped chorioamniotic membrane separation, giving us the moon sign. The patient was further examined. We did a biophysical profile because of the oligohydramnios and the clinical state, and we found a Manning score of 4 out of 8, limited by the anhydramnios and absent fetal tone. These are non-reassuring findings, and the patient was hence referred to a fetal maternal unit for expert management and delivery planning. Further, membrane fusion is typically complete by 14 to 16 weeks gestation. When we see chorioamniotic separation after the second trimester, it is usually iatrogenic post-procedure. Spontaneous chorioamniotic separation at 30 weeks is extremely rare. The moon sign is a pathognomonic sign for this condition, hence this presentation. In conclusion, spontaneous chorioamniotic separation is a rare high-risk cause of third trimester bleeding associated with significant adverse outcomes. The common presentation is heavy vaginal bleeding or history of premature preterm rupture of membrane in second trimester. Now, this chorioamniotic membrane separation can be a marker of chromosomal abnormalities. So once a diagnosis is made, there is an increased risk of preterm delivery, growth restriction, amniotic bands, limb disruptions, and stillbirth due to cord tamponade. As a result, early identification and prompt referral to a tertiary center with expertise in fetal maternal medicine are critical for management. Thank you for listening.